I wanted to particularly talk about electrical stimulation because research findings actually don't prove that it's effective in facial palsy. In fact, there is now some research that shows it can interfere with proper nerve healing and can actually reinforce abnormal movement patterns that can happen in a more severe nerve injury. Also, sticking electrical stimulators on your face is not going to help you relearn expression or functional movements. And it's not going to generate any emotional input as well, which we know is so important for the face. And most of the research that's been done on electrical stimulation is done in the body. And we now know that the body is completely different to the face. So I think what's also important is to think that there is a lot of research that supports other types of therapy, like specialist facial therapy, that are also completely risk-free, that don't interfere with nerve healing and that don't reinforce bad movement patterns. So for that reason, I would say you should avoid electrical stimulation.
No electrical stimulation ever with any category of facial paralysis. So the research findings are that it's not effective in treating facial paralysis. So number one, right off the bat, not effective. Some animal studies were done in, I believe it was in the 70s and 80s, that showed that it may interfere, stimulation may interfere with the development of the growth cone and neural reinnervation. It can reinforce abnormal movement patterns by activating and stimulating more muscles than are intended in a normal, isolated sort of facial expression. It doesn't train function. E-stim doesn't train function and it doesn't train expression. It just flexes a muscle. We find anecdotally, those of us who've been in the field for a long period of time find that electrical stimulation causes more mass action and abnormal movement patterns than patients who don't get electrical stimulation early on. And when you're writing a script for a patient who has facial paralysis, whether it's flaccid paralysis, and in those cases, the therapist should be doing mostly education and eye care. If you write on the script, facial retraining, post whatever the etiology is, no e-stim. Write no e-stim, otherwise most of the therapists you send patients to will do e-stim on these patients.